morning. Gloria Wilder. Gloria is the founder of Core Health, a social justice solutions company that helps to improve the quality of service in underserved communities. She's a nationally recognized expert on poverty and economic segregation in healthcare. Wilder serves as a consultant to numerous foundations and nonprofit organizations, implementing outcome-driven community programs and analyzing effective community initiatives. Wilder served as Director of Community Pediatrics at Georgetown University Medical Center and Chair of Mobile Health Programs at Children's National Medical Center. She oversaw the daily operations of the Children's Health Project of DC. She's a volunteer pediatrician at Safety Net clinics throughout the Washington, D.C. area, and she's also a member of several boards. She's been recognized for her commitment and her work and has received numerous awards, including the Oprah Winfrey Use Your Life Award. She was inducted into the Gold Humanism in Medicine Honor Society, and she received the National Caring Award along with Mother Teresa and Jimmy Carter. It's my extreme honor to introduce to you this morning Dr. Gloria Wilder.
Good morning. Okay, my number one goal this morning, since I got off a plane from St. Louis late last night, is to just breathe. Y'all got this little lack of oxygen thing y'all do here in Colorado, okay? I'm from Brooklyn, New York. See, we got stuff like oxygen in New York. But I do love you all, and I mean that. I really mean that. Because I'm gonna tell y'all something. I'm full. Do you know what that means, to be full? I had the blessing in my career to be able to go to 33 different states and serve children who live in poverty, help families. And one of the most powerful moments in my life, one of the blessings of my career, was when I spent 10 months in New Orleans, Baton Rouge, and Mississippi with Katrina recovery. And I remember being in a school where the whole school was flooded out and the teachers were trying to get the school going again, and they were literally trying to dry out books, pushing mud out, and we were all just helping that day, spraying stuff, and there was a picture of Dr. King on the wall. It's funny, the water level had stopped right at the picture. And the teachers told their stories about, while we're eating lunch, about what happened to them. And they told about floating in the water and about trying to hold on to the roof of their house so that they wouldn't float off. And one teacher, she's telling her story, and she just starts to cry, and she said, "I'm full. I don't have no more. I don't have no more. I can't do this by myself." And then she looked around and she said, "But I'm not by myself. Everybody's here. This community is here, and you all are here to help this community." Well, today, you guys, I'm full. I'm full because I'm 52 years old. Okay, I know, I'm fabulous. Because you know the 50s are fabulous. But I didn't expect to still be talking about these issues at this point in my career. 25 years into being a pediatrician, I didn't expect to still be having to get kids under bridges or, look at the homeless situation, see the dilapidated housing, see parts of our country where people don't have clean water or where we decide to just put lead in the water when it once was clean. I didn't expect this at this point. And maybe that's my naivete. I didn't expect to raise my 4 children and to have to tell my 3 boys, every time you go out the house, be prepared to be pulled over and potentially shot. If you say the wrong thing, if you look the wrong way, if your pants are sagging, if your hood is up, if you're just you could be a target. I didn't expect, after being married for 23 years to a police officer, we're divorced now, it's a good thing. I didn't expect to ever see a day when police officers are just being slaughtered. I didn't expect to be in a nation where the public discourse has become foul, like rotten eggs on a sidewalk in Phoenix in 110-degree weather. I didn't expect any of that. But that's where we are. And so I think it's important for all of us who claim to want justice to start speaking justice. Justice must speak. And if you want to hashtag that justice speaks, okay? Because for too long we've been silent. Healthcare providers, nonprofit providers, housing providers, education providers, teachers, nurses, doctors, all of us. Folks, lawyers in the criminal defense, civil justice, we've all been silent. Oh, we do the work. We do the work, but we're not coming together. We're not coming together to tell the story of what we see and what we know to be true. And instead, we let people stand in front of a microphone who are just vicious with their words and immature and selfish. Senator John Lewis said of George Wallace back in the 60s, he said, George Wallace never threw a bomb. He never fired a gun, but he created a climate and conditions that encouraged vicious attacks against innocent Americans. Because of this atmosphere of hate, 4 little girls were killed on Sunday morning when a church was bombed in Birmingham. They're playing with fire, and if we're not careful, the fire will consume us all. That same statement is relevant today. Y'all, if we ain't careful, the fire is going to consume us all. We're going to start hating on each other for no reason. I don't like what your hair look like, where you get that outfit, your people ain't my people, what ship brought you here. Why are we willing to go back there? Well, I'm going to talk a little Brooklyn with you today, all right? I ain't got no problem with you. That's what I want you to know. I ain't got no problem with you. You good with me. And I start out meeting you with love. That's it. It ain't real complicated, okay? That's the doctor writing a prescription. I write a prescription for love. Every time I meet a new human being, I start out with love. Now, you could whittle that away. Okay, I told y'all I got divorced. But it starts really pure. But let's not let anybody teach us fear. Fear can be both powerful and it can be debilitating. It can be powerful when you decide to conquer your fears and to approach things that you thought you couldn't do. It can be debilitating when you allow your fear to be used as a weapon against others that ultimately kills your very soul. I'm going to just say some stuff. I hope you won't get offended. But if you do, know that I love you anyway. Racism exists, y'all. It exists. And acknowledging racism does not make you a racist. No more than following the stock market makes you rich. Okay? You got to just be real about stuff and say that all of us got some bias. All of us. We're trying to walk in each other's shoes, but the truth is our shoes is different. Some of y'all wearing stilettos I'm not about to get into. All right? Race, class, gender, religion, orientation are the smoke screens used to divide us so that we do not address the real issues in our country. And those issues are the issues of poverty and social injustice. Some stuff is simple. Some stuff is kindergarten simple. You ask a kindergartner, put out all the toys, right? Take as many toys as you want. Then you say that kid who took all the toys, and now got toys all around him, say, would you give a toy to Maxine? She ain't got no toy. They're going to look. They're going to find a toy they can't stand and go, here. Okay, because they know they should share, but they don't really want to share because everybody wants their toys. Well, guess what? That doesn't change in your life. We all want our toys. And truth is, we know we should share. But it's hard. It's hard to be fair and just. But it is required of adults. You can make those mistakes in kindergarten. But if you're still making them when you stand in front of podiums and you talk to the American public, then you got a deeper problem. One that can only be solved on a couch with some Haldol. I'm just saying. There are 5 keys to social justice. No matter where you are in the world, there's 5 keys to social justice. I started teaching this about 15 years ago in some of the medical schools. And those 5 keys to social justice are quality education, quality health care, environmental justice, economic justice, and civil criminal justice. If your life is missing any one of those 5 keys, if any one of those 5 keys is compromised, the other 4 will be compromised. Think about it. If you don't have a quality education, ultimately your health care will be compromised. You may luck out, but the truth is you got to know a little something to be able to work this system we call health care. So let's talk about some of these. I want to share something with you. We know about the challenges we have in education in this country. We know that our education system, for a lot of people, is the haves and have-nots of education. We know that the student loan debt is so high, right, that some folks graduate with their bachelor's degree, but they end up working minimum wage jobs with a student loan debt that's going to keep them in poverty, even though they went to school. We know that there's an imbalance in the quality of education. We know there are multiple universities that have started over the last 10 years that are just plain money grabbers, not providing quality education, but fooling those who don't know better into taking huge student loan debt for a degree that's just not valuable, or 17 certificates. We know so much. We know Head Start is not only successful, but it's necessary for every child, not just poor children. Every child should have a Head Start type program, even if your family is worth billions. Tell the nanny to drop you at the Head Start. Learn to get along with some folk. Learn how to share the toys and read the book. Another pediatric diagnosis. We know health care in America has nothing to do with health. Our system in America is a disease maintenance system. It has never been about health, you guys. Our entire financial coding of healthcare in America has to do with diagnosing a disease, treating the disease, and if the disease is chronic, managing the disease. Did you hear me say cure? No, Did you hear me say prevent? No, we ain't really fond of that. What we want to do if we want to get paid in health care, and I'm going to just be real straight with you because you may or may not know it, okay? But at the end of the day, after the doctor has that powerful moment with you, which that's why we went to medical school. We went to medical school because we really want to do this. We took an oath of non-maleficence, do no harm, with a goal of beneficence, do good. So what's stopping us? You will only pay us if we diagnose a disease in you. If we tell you you are well, we can't code for that, people. Did you know it? Did you know out of the thousands of ICD-10 codes, there's probably less than 20 that have to do with wellness or the fact that you're not diseased right now? So what do we do as your provider? You tell us. Tell us what to do to get your insurance company to pay for us to keep you well. Now, if I can diagnose you with a little high blood pressure, not a lot, I don't want you in the hospital, but just a little something. Little high blood pressure, a little bit of diabetes. We done come up with terms like pre-hypertension, pre-diabetes. We about to have pre-diabetes, right? Let's do pre-asthma, right? Can we do that? Pre-rheumatoid arthritis. You don't have it yet, but, right? Then maybe they'll actually pay when you're not sick. I'm just saying, I'm thinking about it. I'm working this through. If you didn't know it, that's the struggle. That's what nobody's talking about. The sicker you get, the wealthier the healthcare system gets. Okay? If I see you in my office, the visit is $75 to $100. If we see you in the ER, emergency room, same visit, same diagnosis. It's going to be somewhere around $400, $500. If we can get you up onto the floor, a hospital, now we're getting into the thousands, okay? And then, Lord Jesus, this make me nervous. If we get you in a PICU or a MICU bed, ICU, hundreds of thousands of dollars. Now, am I being sarcastic? Absolutely. But there's truth in it. And the truth is that there are a lot of us providers, physicians, nurses, surgeons, specialists who are struggling with the fact that we're actually not allowed to keep you healthy. Oh, Jesus Christ. And we spend the most, our country, gross national product, right, on health. But it ain't got nothing to do with health. Got to do just with disease. There's economic segregation in healthcare. If you have private insurance, your insurance pays for one set of healthcare. If you have public insurance, it pays for another. There are still providers all over this country who will not take public insurance, Medicaid, Medicare. They will only take private insurance or cash. They got that right. They're small businesses, they got that right. But at some point, when it comes to the issues of social justice, we must declare, define, and write the legislation that makes health care and health a right of every citizen in the United States. Because how dare we say to the continent of Africa that they are not caring for their own when we do not care for our own? How dare we look in somebody else's backyard and say, you got too much junk in there, when we basically Sanford and Son. Y'all know Sanford and Son? Okay. There you go. We got to do better, y'all. And we can do better because there's no shortage of money. Don't let anybody lie to you. Oh, we spend more than everybody else, okay? We just spending it in the wrong way. We spending it on the last 30 days of your life. That's the truth. They ain't going to tell you. Okay? But if you were my patient, I'd tell you. I tell the mothers of my kids. I tell you, we're going to spend it all on that last couple of months. oh, we're going to put you on Vance, and we're going to have lines in, we're going to do MRIs on you every day, you know, we're going to do all that. But through your life, we're perfectly comfortable letting you make it on your own. That ain't right. Environmental justice. One of the things I've seen as a pediatrician, you know, we saw Katrina. We saw what happened when the weather changes, hurricanes come, but as a community, a national community, do y'all realize we all connected? We don't respond because it's their problem. It ain't my problem. I noticed driving up here, Colorado, I saw, man, y'all got some beautiful scenery. Wow, man, right? I was taking pictures, just sending it to folks I didn't even know what I was taking a picture of. But it looked good to me. But I noticed them signs saying fire, right? Fire danger, right? You guys have those big fires that come in the mountains. Could wipe it all out, right? What if a fire comes and no planes arrive to drop that blue stuff everywhere? Huh? What happens if those of us in Washington, D.C. and New York and St. Louis and every place else, we just watching TV going, oh, that's such a shame. That people's in Colorado's getting all burned up. Oh, they should have planned for this. Environmental justice. Why are there children in the United States who die of asthma? There are children in the United States who die of asthma because we don't care. We have medications now that are so good that no child should die of asthma. But we keep putting them in dilapidated housing. And for some of those children, the only reason they have asthma is because of where we put them to live when they asked us to help them not be on the street. So the answer to homelessness for a child in America is sometimes I will take you off the street, but I'm going to kill you with the housing I'm going to give you. See what you can do. Get some Clorox, try to do something. Y'all, what we doing? What we doing? Why are we doing this? Why are there folks in the Black Belt counties of Alabama that don't have running water? Ain't never had public sewage, and living in trailer parks. White kids who never saw the inside of a regular apartment building or anything like that, never complained about it because they actually don't, they've grown up this way, so don't really see it as a problem. Up in the Appalachian Mountains where people expect to lose their teeth. Rest of us got teeth. Well into our 60s and 70s, then some of y'all lose your teeth. But why are there kids who think it's natural to just lose your teeth? Environmental justice. Why do we poison children with lead? Because we're pointing fingers at each other from the state to the feds, to the state, to the local, saying, oh, you should clean up that lead. No, you should clean up that. I thought you cleaned up that lead. Economic justice. We have a federal minimum wage of $7.25. Lord Jesus. Slaves made more than $7.25. It's nothing but indentured servitude. That's all it is. When you can work 40 hours, seriously, you can work 40 hours. You're not sitting on your butt. You're not trying. You are trying every single day. and you take home a check that is intended by the very nature of the calculation of the federal poverty guidelines, it is intended to keep you in poverty, even though you're working. Why? How is that just? And I'm a business owner. I own 2 wellness centers. Me and my 4 children built those centers. Cost us over $600,000. I came home one day and told my kids, we taking a second on the house, don't ask no questions. We're going to help some kids in D.C., okay? I got 19 staff people. Nobody on my staff, from the person who opens the door to the person who cleans up after we finish at night, nobody on my staff makes less than a living wage for Washington, D.C. And when we started Core Health and Wellness Centers, the way I had to do that was to not pay myself. But it was the right thing to do. Now, I know some of y'all saying, well, now you're taking it too far. But if as a country we could speak truth, we would know that it's not right for you to go into a restaurant and know that the server who's serving you tonight cannot eat the food that you're getting. Can't afford that meal. You know, ain't gonna get a free meal. I know y'all all think they all get free meals, but some of them don't. They got to pay for their meals. And they cannot afford to eat what they are serving you. And they cannot afford to feed their children, even though they just fed all of yours. Children in this country should not be hungry. We have an abundance of food. There are many people who work at food banks and collect food and give food, and it's wonderful. It's wonderful, you guys. But is it just to give somebody a bag of food on Saturday, but then oppose a living wage on Monday, making them forever dependent on your bag of food? You help yourself when you do that. Because charity without justice is cruel. It's cruel. Even if your heart was in the right place. And lastly, let's get to the criminal and civil justice system. We've seen on the news everything. We know there's some problems with our criminal justice system. Actually, in the United States, there's only 2 forms of universal health care. Did you know it? We actually have universal health care. We've had it for a long time, since the 70s. The first form of universal health care impacts all of us, and that's called the emergency room. EMTALA, Emergency Medical Treatment Liability Act. You can go into any emergency room at any time, anywhere in our country, and you will be treated. If you don't have insurance, they're going to treat you anyway. Don't matter. Now, will you be diagnosed properly? Will you get the opportunity to look at all of what's going on with you? No. What we're going to do is stabilize you so that when you walk out that door, you don't die. That's what we're offering you in the emergency room. We got to stabilize you. We call it treat 'em and street 'em. But so far in our nation, we've decided that's all we all want. That's the only promise of health we want. Unless we go to prison. Because the only other universal health care in the United States is offered only to those who are incarcerated in the federal prison system. We in the United States have a greater percentage of our citizens in the federal prison system than any other country in the world. That should alarm us. Inmates get universal health care. You get a cold, we're gonna take care of you. You need some surgeries, we're gonna take care of that. You know, we even do a little bit of cosmetic stuff, not too much, but enough to make you be able to be in population. In India, 30 out of every 100,000 citizens is imprisoned. In China, 119 of every 100,000 are in prison. In the United Kingdom, it's 148 out of every 100,000 are in prison. In Russia, 628 out of every 100,000 citizens are in prison. In the United States, 750 out of every 100,000 citizens are in prison. I don't understand it. I don't understand it. We got 2.3 million people in our prison systems, 1 out of every 100 Americans, 1 out of every 36 Hispanics, 1 out of every 15 black people. What we doing, y'all? Come on now. We got to do better. We got to stop the excuses, and those of us who know better must speak. Speak. Don't be silenced by bullies. Don't be silenced by people who yell and carry stuff they want to throw. That, like, really? Look at them like, really? You go on and make your poster saying how much you hate me and things like that. Rest of us gonna go have lunch. Some sweet tea and stuff, and while we drinking the sweet tea, we gonna talk about stuff, and we gonna build some nice shelters, we gonna build some schools, we gonna do all this. We ain't waiting for everybody to decide that they wanna do the right thing. All of us can just do the right thing while they working it out. How about that? My mother raised the three of us on welfare. At the time we were on welfare, it was welfare, okay? Now it's temporary assistance to needy families, because when we lessen the benefit, we lengthen the name so nobody will notice. Okay? When we were on welfare, welfare actually was enough, right, to get you started, okay? We had food stamps. We had Medicaid. I went to the public clinics. I was so sick as a kid with scarlet fever and different things, and the clinics that I went to were horrible. They smelled horrible. We were yelled at. I remember being 6 years old and thinking to myself, I'd rather be sick. Mommy, why you keep taking me here? I promise I won't complain. Just give me, an aspirin. I'd rather be sick. Somewhere at that time was when I decided I wanted to be a doctor, because I wanted to change this for other children. I didn't know how. Moving towards social justice requires empathy. My mother worked 3 jobs under the table while she was on welfare. What does that mean, under the table? Wasn't no, cash. Yeah, there you go. Wasn't no taxes. You ain't giving no social security numbers. Right? She worked for a hospital. She worked for a restaurant. And she worked for a taxi cab company. All under the table, because at that time in America, if you were on welfare and you worked, you could go to prison. You weren't allowed to work. You were called names like deadbeat. How you a deadbeat and you working 3 jobs? Your children would hear this. I would hear this. My mother worked those 3 jobs, and because of the strength of my mother, my brother, my sister, and I have gotten 3 bachelor's degrees, 2 master's degrees, 1 PhD, and 1 doctor of medicine. Now, you tell me that's not return on investment for our country. In this example, we're not an exception to the rule. We are the rule. Most children and poor families who we invest in actually return it in spades. One of the kids who's been my patient forever, since he was 2 years old, and then when he was about 7 years old, his mother drowns in the pool, the community pool, with him right next to her. He went on to go to college, do well, and then I'm watching the Super Bowl, New England Patriots versus whoever. Game is over and the Patriots win the Super Bowl, and my phone starts blowing up. It's his grandmother saying, Tavon got his first Super Bowl ring and he's drinking your smoothies, Dr. Wilder. Return on investment. I'm going to wrap up in a minute. But I just got some things I need to say to you before we go and sit down. Dr. King in 1963 said, he wrote a book, Why We Can't Wait, from the Birmingham jail. And I want you to read the book. If you can't read the book, get your children to read the book. Let them read that book and let them read Night by Elie Wiesel. Let them understand why you can't be silent in this country. Why those of goodwill must speak. Stop assuming that everybody knows you of goodwill. When it comes to this question, Niemoller wrote a poem and he said, first they came for the Jews, and I did not speak because I was not a Jew. Then they came for the communists, and I did not speak because I'm not a communist. Then they came for the trade unionist, and I did not speak because I was not a trade unionist. Then they came for me, and there was no one left to speak. Oh, they coming for you. They coming for each one of us if we do not speak. If we do not say that America is greater than any single individual, and America is about unity, respect, and pride. In my life, I know I would not be standing here if it hadn't been for the people in my community and outside of my community who spoke justice in the 60s, who demanded that this little black girl could go to Georgetown University for medical school. When I arrived at Georgetown for first day of medical school, I was one of 2 black students in a class of hundreds. And I ain't that old. I told y'all I'm 52. I graduated from medical school in '93. It wasn't so long ago, y'all. I'm going to close by telling you about one man who changed my life. And I told you about my mom. We were so poor. First of all, we were so poor that we spelled poor P-O, right? Because we couldn't afford the O-R. So we just P-O. And on the weekends, we would go around, my mother would have us go around the neighborhood and look for coins, pennies, nickels, things, because we didn't have food. We ate from school. And so when school closed on Friday, we wouldn't have food, right? So we would collect pennies. And this one Saturday, we collected the pennies, and we come back home, and Mommy's adding them up. My mother finished the 8th grade, and we got 99 cents. And she put it in like a Ziploc bag, and she told me and my sister Terry, she said, y'all go to the corner store, go to Duke, and tell Duke to give you a 1/4 pound of bologna and a bag of bread. And so we took the pennies, well, I took the penny, and we walked to the corner store. My sister was fancy, She was the prettier one, and she was more fancy and stuff. And I was always thickalicious, you know what I'm saying? So we get to the store, and we're about to go in, and my sister said, I ain't going in there and begging for no bread and stuff. And I said, well, I'm going in because I want that bologna. And I went in and I said, Duke, Mama said give us a 1/4 pound of bologna and a bag of bread. And I was all happy because we was going to eat. And so I reach in my pocket for the bag of pennies. And as I'm reaching in, the door to the store busts open. And kids start flying in from the neighborhood, just having fun and picking up ice cream and chips and peaches. And now they're lining up behind me to pay for what they got. And I think to myself, I got a bag of pennies. And I look at Duke. And I take the pennies, I'm bringing them up to the counter. And in my head, I'm thinking, now they all gonna know I'm poor. Now they was poor too, but didn't nobody want to say it. And Duke reaches out his hand and covers my hand and scoops up that bag of pennies. And he brings it under the counter. And he's looking at me. I was about 6 years old. He said, Shorty was Duke's assistant in the bag. He said, Shorty, get her that bag of bread, that pound of bologna, pound of that cheese, and one of them cartons of milk, some of them chips and ice cream. And I'm looking, because I know I got 99 cents. And Duke now has this big bag of groceries, and he's pushing it towards me. And I slowly wrap my hands around the groceries, and I'm just looking at him. And I start to back away with the groceries, and I'm heading over to the door, hoping he ain't gonna count them pennies. And as I get close to the door, Duke says, Gloria, tell your mama I said hi. And I go, okay. He said, and don't forget your change. And he handed me a 1/4. Ooh, y'all. I can't never tell it without feeling it. That 1/4 told that little girl that she was worth something. And that her family was to be respected. And that the journey we was on, it wasn't our fault. It just was. Here's big old Duke. That 1/4 got me to be a pediatrician, made me help with mobile programs across the country, brought me to 33 different states, and brings me here to you today. To just say, as you think about all this craziness you're about to see on TV for the next 100 days, as you think about the shootings and all this nonsense, just just remember that you always have an opportunity to be a Duke in the life of a child here in the United States or anywhere in the world. Doing the right thing is your return on investment. I love you all. Be at peace.